Hypertension is the most common cause of cardiovascular disease, stroke, heart attack, all kinds of difficulties, and it affects at least 1/3 of all Americans. Last December, when I was at the Anti-Aging Congress in Las Vegas, I was wandering through the exhibit hall and saw that they were passing out drops for blood pressure. So I had my blood pressure checked. It was 134/84, which is a little high for me. And I took 30 drops of Kyani Nitro Extreme, and within 5 minutes, my blood pressure dropped to 117/71. I was impressed. My associate Robert was with me. He had the same kind of effect. Now, I usually don't do research out of the blue unless I get a grant to do it, but I feel that hypertension is so important and that antihypertensive drugs are so bad that it was worthwhile. I told the company I would do the research if they would supply the product, which they kindly did. I enrolled 31 individuals with hypertension, minimum blood pressure 147/92. That's sort of borderline, but close enough to need care. And of course, a number of them were quite high. There were 19 men and 13 women. All but 2 of the men were quite overweight, and a little over half of the women were overweight. 12 of the individuals were on antihypertensive drugs, including sometimes 3 drugs, and still had significant hypertension. So under an IRB protocol, we had these people come in and screen them and gave them 30 drops of Kyani Nitro Extreme, waited 20 to 30 minutes, and in all but 2 of them, blood pressure had come down significantly right away. So they were sent home with instructions to take 30 drops morning and night and come back in 2 weeks. Now, the 2 who didn't go down, I had come back in a week, and one of them had responded at that time and the other one did not. In the long run, we found that 29 people completed the study. We had really quite striking results. 69%. 19 of 29 people had striking results. Decrease in blood pressure to within the normal range. 2 of them still a little bit high, but they were down 10 or 12% from what we started with. And we followed them 3 to 4 months. Half of the people who were on antihypertensive drugs, which weren't doing the job anyway, were weaned off them successfully, and the other half at least had decreased the amount of drugs they were taking. I do not know a drug in almost any field which is 69% effective.